Hello, everyone, and welcome to Part A POE Teatime, Bite-Sized Learning on Busy Days. This is the second video in our series on NGSConnex. In this session, I will show you what eligibility information is in the Connex portal for Medicare beneficiaries in jurisdictions 6 and K. On November 18th, 2024, NGS disabled the beneficiary eligibility lookup function in the IVR. NGS has been notifying providers of this change. So as a provider, you will need to determine if this changes how you obtain beneficiary eligibility. With that being said, I wanted to take some time to show you what eligibility information is available within NGSConnex. Knowing if your patient is Medicare eligible for services is important for correct claims billing. So let's dive in and take a look and see what information is out there. I did a previous video on accessing NGSConnex. Please review that video if you are unsure of how to register or access NGSConnex. But for the purposes of this video, after logging into NGSConnex, you are going to want to click the eligibility lookup button from the NGSConnex homepage. In the Select a Provider panel, you will want to click the Select button next to the applicable provider account that you are reviewing or working under. In the Select a Beneficiary panel, you will need to enter the CMS required beneficiary demographic information in the applicable fields. So you will need to enter the Medicare number. You'll enter the Medicare beneficiary identifier as it appears on the Medicare card. You will also need to enter the beneficiary's last name. You will need to enter at a minimum the first 6 letters of the last name exactly as it appears on the Medicare card. You will also need to enter at least the first letter of the first name and the date of birth, and it will need to be in a 2-digit month, 2-digit day, 4-digit year format. You will then click the Submit button. I want to switch gears for just a moment and touch on the MBI lookup tool. The MBI lookup should only be used when you have attempted to obtain a copy of the patient's Medicare card or MBI from the patient or the patient's caregiver. The MBI lookup will allow you to search for and receive a patient's MBI. So you will click the MBI lookup button from the NGSConnex homepage. The MBI lookup window will then display for you. You will confirm your identity by selecting I am human checkbox. A group of images may display. If they do display, you will be asked to select all of the images of a specific type. Once validation is successful, the MBI lookup search panel will display for you. Here you are seeing that MBI lookup search panel. You will need to enter the required search criteria in the applicable fields to initiate that search. You will need to enter the first and last name of the beneficiary, and the information entered must match exactly as to what is on file with the Social Security Administration. You will then need to enter the beneficiary's Social Security number and the date of birth, again in a 2-digit month, 2-digit day, 4-digit year format, and then select the Submit button. The beneficiary's MBI number and name will display for you. You will have the option to use the MBI to perform other transactions in Connex. Simply select the Use This MBI button, and the MBI will auto-populate in other areas of the portal. If you want to search for a different patient's MBI, you can click the New MBI link. If the search criteria entered is invalid or does not match what is on file with the Social Security Administration, or is for a deceased Medicare beneficiary whose date of death is more than 4 years prior to the date of death, an error message is going to display for you. You can select the New MBI lookup link to initiate a search for a different patient. Okay, so let's get back to looking for eligibility in the portal. Please note that you can select the years of data that you would like to view by selecting 1 through 4. The historical eligibility information displayed will depend on that filter selection. The 4-year maximum of historical information available does not apply to diabetes self-management training, or DSMT, and medical nutrition therapy, or MNT. If you would like that additional information, click the drop-down arrow and select yes. If you do select this additional information, please allow a few additional moments for your eligibility results to display. You will then select the search button. You can launch a patient status lookup within this portal. To do this, you will select the patient status button as shown here on this slide, and you will enter the from and to dates of service and then select the search button. The system will search for claims that match your search criteria. The patient search panel will then show you the claim type, the from and to dates, the facility type, and the NPI. The Beneficiary Eligibility Information Panel will provide an overview of basic Medicare eligibility information for you. This panel will show you the Medicare beneficiary identifier, first and last name, the MBI term date, if applicable. Keep in mind that Medicare beneficiaries or their authorized representatives can ask to have MBIs changed. So, for example, if they feel that their MBI was compromised, CMS can also change an MBI. If a term date displays, you must contact the beneficiary to obtain that new MBI, or use the MBI lookup tool that I just mentioned as a last option to search for that new MBI. The eligibility panel will also give you the date of birth, date of death if applicable, the sex of the beneficiary, and the address, including the city, state, and zip code. You will also notice the left side navigation. To reduce the amount of scrolling required, we added that left side navigation to allow you to view information in smaller portions. This left side navigation will list everything available in the portal regarding eligibility. If there is a no icon next to one of the options listed, that signifies that that information does not apply to that beneficiary. The entitlement information section will provide you with the Part A and Part B beneficiary entitlement reason code. The most recent entitlement reason code for coverage will display. The Part A and Part B entitlement dates, Part A and Part B termination dates, if applicable, prior Part B entitlement and termination dates, if applicable, and the Medicare inactive begin and end dates. So for these dates, the beginning and end dates are for the period of inactivity when the beneficiary entitled to Medicare was ineligible for Medicare benefits over a period of time for one of the following reasons. And this could be because the beneficiary was classified as an illegal alien in the United States, the beneficiary was deported from the United States, or the beneficiary was incarcerated. You must contact the beneficiary to determine who is responsible for coverage during those dates. Moving on, the additional information section will provide you with the following information. You'll be able to see the full and copay inpatient days, inpatient deductible amount remaining, full and copay SNF days, inpatient blood deductible units remaining, lifetime psychiatric and reserve days remaining, as well as the earliest and latest billing dates. I just want to touch on printable view for just a moment. If you prefer to view all available eligibility information in one document, or if you would like to save this information to your system for your records, you can select the printable view link in the upper right-hand corner of the beneficiary eligibility panel. All of the available eligibility information will be displayed in a separate window, so you can right-click to print it or save that information to your own system, and then you can simply close that new window to return to this original view. If you would like to initiate an eligibility search for a different beneficiary, simply click the Change Beneficiary link located in the Select a Beneficiary panel. Now let's take a look at what detailed eligibility information is available in Connex. Now this session is geared toward Part A providers. However, if you need Part B deductible information, it is available to you. The information displayed in this section will provide the current year's Part B deductible amount and if available, up to 4 years of additional historical deductible information. So you'll be able to see the deductible year, deductible amount, as well as any remaining deductible amount. If the Part B deductible information does not display for a specific year, it may be because the beneficiary is or was enrolled in the Q&B program. If so, you are prohibited from billing the patient for Medicare Part B deductibles, co-insurance, and co-payments. Regarding Medicare Advantage or MA information, you will want to select Medicare Advantage from that left side navigation. Information will display if the beneficiary is currently enrolled in a Part C Medicare Advantage plan, also referred to as a Medicare HMO or a Medicare replacement plan. The MA plan section will also display historical MA plan information up to the previous 4 years from the date of the search, depending on the selections made during the eligibility search when it was initiated. Please keep in mind that this information is important as it will impact who is billed for the services rendered. National Government Services is a traditional fee-for-service Medicare payer and does not process Part C Medicare Advantage claims. If the beneficiary has selected an MA plan, you must contact that plan to determine billing and coverage. Once you select Medicare Advantage from the left side navigation, you will be able to see the effective and termination dates, the administering insurance company. If available, the name of the private insurance company administering the MA plan will display for you. The plan name, and again, if available, the specific plan name the beneficiary is covered under will display for you. And you can select the drop-down arrow to view additional information on that plan. You can also see the plan website and plan telephone number. You will see the contract number. You will also see the plan number and the plan option code description. Information displayed in this column will provide additional details regarding who is responsible for the services rendered. Please note, if the beneficiary is not currently enrolled in a Part C Medicare Advantage plan or hasn't been covered by an MA plan in the past 4 years from the date that you initiated your search, this panel will be blank. Let's now review how to find Medicare secondary payer information. To view MSP information, you will select Medicare secondary payer from the left side navigation. The MSP section will display information about other insurance coverage the beneficiary may have that is primary to Medicare. The most current record will display first. This information is important as it will impact who is billed first for the services rendered. So the following information will be provided to you. You'll be able to see the beneficiary effective and termination dates. You'll see a field labeled indicator, and the options are primary payer to Medicare or Medicare is primary. You'll be able to see the type, the ORM indicator, the term ongoing responsibility indicator, or ORM, means the responsible reporting entity's ongoing responsibility to pay for the injured party or Medicare beneficiaries' medicals associated with the claim. And those options are yes, no, or NA. You will also see related diagnosis codes. So if the primary payer is limiting coverage to specific diagnosis codes, the ICD-10 diagnosis codes will be provided if available. If the related diagnosis code field is blank, then there are no ICD-10 related codes available. You will also be able to see the insurer name, and you can select the drop-down arrow and the administering insurance company name and address will display. Keep in mind, if the beneficiary does not have a primary payer to Medicare or hasn't had a primary payer to Medicare in the past 4 years from the date you initiated your search, this panel will be blank. The crossover section will display information if the beneficiary has crossover or secondary insurance information on file with Medicare. Crossover claims are claims that Medicare has automatically sent or crossed over to a supplemental payer after Medicare has made its payment determination. Crossover claims are not Medicare secondary payer claims. So over in the left side navigation, you will select crossover. Crossover information is provided for informational purposes and is submitted and maintained by Medicare crossover trading partners. This is not a comprehensive list of any or all possible Medicare supplemental coverage. This only represents Medicare crossover trading partners that have signed agreements with Medicare. So this means a beneficiary may have other supplemental coverage not specified here. You will need to obtain supplemental insurer information directly from the beneficiary. To determine if a specific claim has crossed over, you will need to refer to your remittance advice. Under this option, the following information will be provided for you. So you'll be able to see the creation date, update date, the insurance code, the insurance name, and you can select the drop-down arrow. The administering insurance company name and address will display for you, and you'll also be able to see the insurer effective and termination dates. Remember earlier when I mentioned QMB? People with Medicare who are in the QMB program are also enrolled in Medicaid and get help with their Medicare premiums and cost sharing. Medicare providers may not bill people in the QMB program for Medicare deductibles, coinsurance, or copays, but state Medicaid programs may pay for those costs. Under some circumstances, federal law lets states limit how much they pay providers for Medicare cost sharing. Even when that's the case, people in the QMB program have no legal obligation to pay Medicare providers for Medicare Part A or Part B cost sharing. The QMB information panel provides information when a beneficiary is enrolled in the QMB program. This information is important because, again, you may not bill the beneficiary for Medicare deductibles, coinsurance, or copays during the QMB effective and termination dates. So under this option, you will be provided with those effective and termination dates as well as the state. To review home health plan information, you will select Home Health Plan from the left side navigation. The Home Health Plan information section will display information if the beneficiary is currently in a home health episode of care. The Home Health Plan information will also display up to 4 years worth of historical information from the date that you initiated your search. The information the information that is provided under this option is the home health start and end dates, the dates of the earliest and latest billing activity, the patient status. So in this field, it will provide you with the 2-digit patient status code, and the description will display. And the NPI for the home health agency providing care will also display for you. With that said, let's now discuss reviewing hospice information. To view hospice notice of election, you will need to select Notice of Elections or NOE information from the left side navigation. The NOE is submitted to notify the Medicare contractor of the start date of the beneficiary's election to the hospice benefit. The Hospice Notice of Election information section will display information if the beneficiary has currently elected to receive hospice care or has elected to receive hospice care in the past. All benefit periods and NOEs will be provided. The following information will be provided to you, so you'll be able to see the NOE receipt date. The NOE must be submitted to Medicare and accepted within 5 calendar days of the date of election in order for it to be timely. You'll be able to see the NOE revocation date. A notice of termination or revocation, also known by its type of bill, the 8XB, must be submitted to and accepted within 5 calendar days after the hospice discharge or revocation, unless a final hospice claim has already been submitted. You'll also be able to see the NOE revocation indicator and the NPI of the hospice provider. You can also select hospice benefit periods from the left side navigation to review additional information. The hospice benefit periods information section will display information if the beneficiary has elected to receive hospice care or has elected to receive hospice care in the past. All benefit periods will be provided based upon the claims submitted by the hospice provider. The hospice benefit periods will be blank when there have been no claims received by Medicare. So you will be able to view under this option the start date, and that the date display reflects the start date of a beneficiary's elected benefit period of hospice coverage. The end date, the date display reflects the end date of a beneficiary's elected benefit period of hospice coverage. Dates of earliest and latest billing activity for the benefit period of hospice coverage. The dates used. This is the number of days used for the benefit period as of under hospice coverage, and the NPI for the hospice provider for the elected benefit period of hospice coverage, as well as the benefit period number. To view inpatient and SNF spell history, you will select inpatient and SNF spell history from the left side navigation. The inpatient and SNF spell history section will display information if the beneficiary is currently receiving inpatient or SNF care or has received inpatient or SNF care in the previous 4 years from the date that you initiated your eligibility search. You will be able to review the spell number, the type, either inpatient or SNF, the start and end dates, and the billing NPI. The end-stage renal disease or ESRD information panel provides information when a beneficiary is eligible for Medicare due to ESRD. This information is important because some covered services are not separately payable and are part of the ESRD consolidated payment. To view this information, you simply select ESRD from that left side navigation, and then the following information will display for you. You'll see the coverage start and end dates, dialysis start and end dates, and the transplant date. The Preventative Services section provides a list of Medicare-covered preventative services that are eligible for coverage for the beneficiary and when they are next eligible for the service. So under this option, the following information is provided for you. You'll be able to see the procedure and the description, modifier, next eligibility date, deductible applies. And for this field, if the Medicare deductible can be applied, this field will auto-populate with a yes. If not, the field will auto-populate with a no. And you also have a field that states co-insurance applies. And for that field, if the Medicare co-insurance can be applied, the field will auto-populate with a yes. If not, the field will auto-populate with a no. The audiology screening section provides a list of Medicare-covered audiology screening services that are eligible for coverage for the beneficiary and when they are next eligible for the service. This information is available for Medicare beneficiaries who have active Medicare Part B coverage and do not have a date of death on file at the time that the eligibility search was initiated. So under this option, you'll be able to see the procedure and description, modifier, the screening type, either professional or technical, the next eligibility date, and for this field, if the service includes only a professional component, the service's detail will include a qualifier indicating the next eligible date is for the professional services only. You will also see the deductible, which is the Part B deductible amount, and coinsurance of 20%. In regards to hepatitis screening, the Medicare beneficiary must have active Part B coverage and also must not have a date of death on file at the time that the search was initiated. The following information for the most recent occurrence for the procedure code will display for the HCPCS code listed on this slide. So you'll be able to see the procedure and the procedure description, the date of service, the rendering provider NPI, the deductible, which is the Part B deductible for the date of service, and the coinsurance of 20%. The COVID-19 vaccine information panel provides the following information. You'll be able to see the procedure code and the description, the date of service, and the rendering NPI. And again, note that the beneficiary must have active Part B coverage and must not have a date of death on file at the time that the search was initiated. You will also find the patient's flu vaccine history in this section of the portal. The beneficiary, again, must have active Part B coverage and must not have a date of death on file at the time that this search was initiated. Under this option, you'll be able to see the procedure and procedure description, the date of service, and the rendering provider NPI. The pneumococcal vaccine panel provides information for a few pneumococcal vaccine codes. And again, the beneficiary must have Part B coverage and must not have a date of death on file at the time that you initiated your search. Under this option, you'll be able to see the procedure and procedure description, the date of service, and the rendering NPI. Medicare Part B does provide coverage for a cardiac rehabilitation or physical therapy program if a Medicare beneficiary has had at least one of the following conditions: a heart attack in the last 12 months, coronary artery bypass surgery, current stable angina pectoris, a heart valve repair, a heart valve repair or replacement, a coronary angioplasty or coronary stent, a heart or heart-lung transplant, or stable chronic heart failure. Medicare covers up to 2 one-hour sessions per day for up to 36 sessions. These sessions must occur during a 36-week period. If medically necessary, Medicare will cover an additional 36 sessions. So under this option, you will be able to see the number of sessions used and the session type. Medicare Part B also covers a comprehensive pulmonary rehabilitation program if a Medicare beneficiary has moderate to very severe COPD. Medicare typically covers up to 36 pulmonary rehabilitation sessions. However, if medically necessary, Medicare may cover an additional 36. So under this option, you'll be able to see the number of sessions remaining and the session type. Regarding acupuncture benefits, NGS will tell you the session type, sessions remaining, the next eligible date, and the initial session date. Do you need information on smoking cessation counseling? Medicare Part B covers up to 8 visits of smoking and tobacco use cessation counseling visits in a 12-month period. So Connex will tell you the total sessions available, initial session date, and any remaining sessions. The Cognitive Assessment and Care Plan Information Panel provides information for the following HCPCS codes, and it's 99483. That is the assessment of and care planning for impaired thought processing, typically 50 minutes. The Medicare beneficiary must have active Part B coverage and must not have a date of death on file at the time you did your search. The following information for the most recent occurrence for that procedure code will display. And what you will see is the procedure and procedure description, the date of service, and the rendering provider NPI. The Therapy Services Information Panel will provide information on the current year's occupational, physical, and speech therapy amounts used, and if available, up to 4 years of additional therapy amounts used. The following information will display, so you'll be able to see the therapy service year and occupational and physical therapy amounts used. This is occupational, physical, and speech therapy services used dollar amount applied to the capitation limit associated with the calendar year indicated. Medicare Part B covers outpatient DSMT if a patient has been diagnosed with diabetes. Medicare may cover up to 10 hours of initial DSMT, which is 1 hour of individual training, and 9 hours of group training. Medicare may cover up to 2 hours of follow-up DSMT training each year if it takes place in a calendar year after the year the patient received their initial training. The DSMT panel will be blank when there are not any processed DSMT claims on file with Medicare. And remember, the 4-year maximum of historical information available does not apply to DSMT. If you do select this option in the portal, it will show you the initial date of service and minutes of initial time remaining. Medicare Part B covers MNT services and certain related services if a patient has diabetes or kidney disease, or has had a kidney transplant in the last 36 months. The following information will be provided. You'll be able to see the initial date of service, the minutes of initial time remaining, and the minutes of follow-up time remaining. Remember again that the 4-year maximum of historical information available does not apply to MNT. And the last thing I wanted to touch on regarding eligibility is the Medicare Diabetes Prevention Program. This expanded model is a structured intervention with the goal of preventing type 2 diabetes in individuals with an indication of prediabetes. Medicare beneficiaries who are currently enrolled in Medicare Part B and meet specific clinical requirements are eligible to participate in this program. Deductible and coinsurance is not applicable for the Medicare Diabetes Prevention Program services. Under this option, Connex is going to show you the procedure and the description, the date of service, and the rendering MPI. You can obtain additional information regarding the Medicare Diabetes Prevention Program in the Medicare Diabetes Prevention Program Manual. As you can see, there is a lot of valuable information available in the NGSConnex portal. The next video in this series will be on claim status lookup. I just wanted to take a moment to thank you for taking time out of your busy day to review this video. Take care and enjoy the rest of your day.